Thank you all for joining us today with our event, Let's Talk HPV with Dr. Masiray Kamara. I'm Yoreni Syme, and I am with the Partnership for Maternal and Child Health of Northern New Jersey. And this is a collaboration between the partnership as well as with Rutgers Cancer Institute of New Jersey.
Hello, everyone. My name is Ashley. I work for Rutgers Cancer Institute of New Jersey. And part of that is we run a grant program called Screen NJ. And so I'm representing both here today. Thank you.
Thanks, Ashley. So yes, as part of the partnership, I'm the Public Health Program Coordinator under the Immunization Initiatives Program at the partnership. And we're bringing this to you in honor of National Immunization Awareness Month. And thank you, Ashley, for introducing yourself. I'm going to go ahead and introduce the doctor who will be speaking today about HPV and answering all of our questions. So this is going to be a Q&A session with Dr. Masiray Kamara. Dr. Kamara was born in New York and spent her childhood growing up in Sierra Leone, West Africa. She received her undergraduate degree in 2007 from Johns Hopkins University, her medical degree in 2012 from Temple University School of Medicine, and completed her master's in public health in 2013 from Columbia University. She went on to complete her pediatric residency at Thomas Jefferson University. With a strong interest in global health, Dr. Kamara has done volunteer work in various developing countries and currently holds a diploma in tropical medicine from the London School of Tropical Medicine and Hygiene. Dr. Kamara currently serves as an outpatient pediatrician here in East Orange, New Jersey at Foundation Pediatrics and the East Orange Health Department and Human Services. So thank you, Dr. Kamara, for being here with us today. We are looking forward to having a conversation with you, and anyone that is, a participant in this webinar, we encourage you as well to ask Dr. Kamara questions when it comes to the Q&A section of this presentation. And so now I would like to, share with you some information before we begin our Q&A portion with Dr. Kamara. It's going to be a quick background on HPV. I know many of you are healthcare professionals, you are nurses, you are in the field, you are doing this work. But I know that there are some other healthcare professionals who may not be as knowledgeable about a lot of the information that will be shared today. So we want to make sure that everyone kind of has a foundation of this information. So moving forward. Before I begin, just some quick disclosures. Neither the speaker nor the planner have any conflicts to disclose, and funding for this initiative has been provided through a grant to the Partnership for Maternal and Child Health of Northern New Jersey from the White Hill Foundation. All right, so let's get right into it. HPV is the most common STI. So approximately 79 million people in the United States are currently infected with HPV, making it the most common sexually transmitted infection. It is so common that 8 out of 10 sexually out of 10 individuals will be exposed to HPV at some point in their lives. There are over 150 strains of HPV. HPV is spread through intimate skin-to-skin contact by having sex, including vaginal, anal, and oral sex with someone who has the virus, even if they don't have any signs or symptoms. It is divided into 2 categories based on risk. So low-risk HPV does not generally cause cancer, but it does cause genital warts. High-risk HPV causes cancer. Most common are HPV strains 16 and 18, which are responsible for most cervical and oropharyngeal cancers. In most cases, 9 out of 10 HPV cases will go away on its own without causing any health problems. However, when HPV does not go away, it can cause genital warts or cancer. On this graph, we share some statistics. So this graphic shows the number of individuals diagnosed with HPV-related cancers per year. So per year, 14,000 individuals are diagnosed with oropharyngeal cancer, and this surpasses the numbers of individuals diagnosed per year for cervical cancer, which is 11,000. Oropharyngeal cancer is now the most diagnosed type of HPV-related cancer. So as you can see on the left hand side, the 6 different types of cancer that HPV can cause, and the number of diagnoses on the right hand side. So cervical cancer is the only type of HPV-related cancer that has a recommended screening tool for early detection. Even with screening methods to detect cervical cancer, such as pap smears, 4,000 women die every year from cervical cancer, and more than 9 out of 10 cervical cancer cases are caused by HPV infections, and almost all of them can be prevented with the HPV vaccine. Vaccination and screening makes cervical cancer the most preventable cancer. Other cancers caused by HPV do not have recommended screening tools and may not be detected until it causes some serious health concerns. And vaccinating teens for HPV can prevent 90% of these cancers from developing, or about 33,700 cases per year. The American Cancer Society and the American Academy of Pediatrics recommend HPV vaccination between the ages of 9 through 12. And we want to make sure that we are recommending it as early as 9. Studies have shown that initiating HPV vaccine at ages 9 through 10 were more likely to be fully up to date by 13.5 years old compared to starting vaccines at ages 11 and 12. Older adolescents have fewer doctor visits, therefore, initiating a series early provides more opportunities to complete the series on time. This will allow providers to give the 2 HPV vaccine doses at 12 months apart at the annual well child visit at ages 9 and 10. Providers have also found that conversations tend to be easier because sex is usually not a concern for parents with children ages 9 and 10. Also, by initiating earlier, there will be fewer vaccines needed to be given per visit. Sometimes when vaccines are bundled, the parent may or may not opt for getting the vaccines that are mandatory. And also there are parental concerns regarding 3 vaccines during one visit. So as you can see on the, the little diagrams on the bottom, we want to make sure that we are getting our children vaccinated on time, meaning as early as 9. If we wait until ages 13 and 14, at this point, we may already be a little late. And then as an adult, ages 15 to 20, we are late, and we're going to require an extra 3rd dose for anyone initiating vaccination after the age of 15. We want to share also some information on the New Jersey HPV vaccine coverage rates. So this graph here shows national and state data collected from the CDC's annual National Immunization Survey, NIS-TEEN. This graph illustrates vaccinations for meningococcal ACWY, Tdap, HPV, and flu. Both meningococcal ACWY and Tdap vaccines, their rates in New Jersey are above the national average and have met the Healthy People 2020 goal. And New Jersey HPV rates are slightly below the national average for the and the Healthy People the 80% Healthy People 2020 goal. And the 2020 goal is the same as the 2030 goal, which we are now moving to also reach. But as you can see on the graph, the rates are excellent when it comes to meningococcal and Tdap, and as you can see here with HPV, it's much below our Healthy People 2030 goal. So much lower rates, and the HPV vaccine is recommended at the preteen age of 11 through 12, which is when teens are due for their Tdap and meningococcal vaccine. Also, unfortunately, declines in pediatric vaccination rate due to the COVID-19 pandemic as well. We know that during the pandemic, we weren't going to the doctor. We were telling everyone to stay home. We were not vaccinating for any, disease. And now the rates have dropped, especially for HPV. A little bit more here on the estimated HPV coverage rate. So this is the latest information that is out. up-to-date vaccination rates in New Jersey for teens 13 to 17 years old increased from 42.8 in 2016 to 59.7 in 2020, which is great. However, this goal is still lower than the Healthy People 2030, than the 2020 goal and also the 2030 goal of 80%. And while it was, 59.7, with the following years, it actually has decreased, and it is currently at 54.8. So unfortunately, it has been slowly decreasing, but we want to continue to move these rates up. 63% of female adolescents in New Jersey aged 13 to 17 are up to date with their HPV vaccinations, and 47% of male adolescents in New Jersey aged 13 to 17 are up to date with their HPV vaccinations. So this is the latest information that we have out, and you can see the trend both going up, but also up to date going down. Quickly, before we talk more about this with Dr. Kamara, here are some strategies to increase vaccination rates in your clinics. If you are a provider, if you are a pediatrician, nurses, we suggest bundling the vaccine where possible. So we know that the HPV vaccine is not a required vaccine for schools, but we want providers to include it with the other required vaccines that they need, such as Tdap and such as meningococcal. We also want to, provide motivational interviewing, which is a strategy to include parents to come with their own conclusion and make their own decision for their children. We also want to make sure that we are using the HPV vaccine as a cancer prevention tool and talking about preventing cancer as opposed to talking about sex, because we know that that will decrease the likelihood for parents to want to get their child vaccinated when they assume that it is a sex-related vaccine. So we want to make sure that we are using this as a cancer prevention tool when we're talking to parents. Also, we want to use consistent HPV messaging throughout the clinic. So all office staff, including front desk staff, should receive training on how to communicate with parents and patients on HPV vaccine and be prepared to answer questions as well. The way an office staff communicates this information can influence a parent's decision to vaccinate their child against HPV. We also want to recommend implementing a reminder recall process to check patients' immunization status at every visit. So if the vaccine was refused during the visit, use the next visit as an opportunity to provide education on vaccine importance. Just a little tidbit, on my team, we work hand in hand with NJIS, and members of our team can also provide trainings and education on how to enroll in NJIS, how to use it, and how to use reminder recall. So much later, I'll drop the link for the website for NJIS onto the chat. So that way, if there are any folks here that are interested or that have not yet enrolled in NJIS or just need a refresher training, that is a resource that you can use. Also, moving forward, sharing personal experiences. So using personal examples to illustrate the importance of this vaccine, sharing personal examples of your decision to vaccinate your family to provide cancer protection is a great way to connect with parents one-on-one, and also kind of remove that fear of feeling, well, this is my doctor. I don't really feel comfortable talking to them about it. They might feel ashamed or uncomfortable, and this is a great time to provide your own personal experience so that they can see their providers and as well as, parents just like they are. And also, last but not least, answer questions effectively. So being prepared to answer patients' questions regarding the HPV vaccine. The CDC has a great guide that can be reviewed to help answer commonly asked questions. So thank you for, listening in on these strategies. And I hope that maybe one of these can be beneficial to you at your site. But now we would like to move forward with the Q&A with Dr. Kamara. And what I ask of everyone is that if you would like to write your question in the chat, feel free to do so. And if at the end of the Q&A section that you still have a question, you can just, unmute your microphone and ask her directly. So I'm going to stop sharing my screen, and I'm going to, let you all meet Dr. Kamara. So I am going to quickly spotlight Dr. Kamara. There we go. Hi, Dr. Kamara, how are you?
I am doing well. Good afternoon to you and Ashley. Good afternoon to everyone who joined. Thank you so much for having me on this call today.
Thanks so much. So I don't know if you want to go ahead and take it away, Ashley. Please feel free.
Yes, thank you. So before we turn to the audience for questions, Yoreni and I did come up with a few that we would like to ask Dr. Kamara. So to start, really, why do children need to be vaccinated so early, like so young in their lives?
That's actually a really, really good question because I get asked that a lot in my outpatient practice, especially since it's being recommended, right, that we vaccinate starting as early as the age of 9. Usually most practices will do it at the age of 11, which is when they have to come in to get their tetanus or their meningitis vaccine. But the reason why it's recommended to do it so early is because actually this vaccine works if it's done early. As was already discussed previously in the other slides, that it's passed on through sex, but not only just through sex, you just need to have intimate skin-to-skin contact. So what does that mean? That means that you don't have to do all the way, if that makes sense. You just have to have your private parts rubbing either against each other, or if you're performing oral sex, which some people, especially young people, may do, thinking that they're not really having sex, right? So what the studies that have been done, what it's shown is that if you get vaccinated before you're exposed to any of the strands, this vaccine works fantastic. It is 97% effective in preventing cervical cancer. It is actually almost 100% effective in preventing genital warts. And for all the other cancers that was mentioned earlier, because it's not only just cervical cancer, we spent a lot of time highlighting that, which is really great and important, but also too, it does cause the other cancers. And as Yoreni pointed out earlier, that the oral cancers, so these are the ones that form in the back of the throat, the base of the tonsils. These are the cancers that the rates is actually higher than cervical cancer. So if you were to actually vaccinate way early, before your child even gets exposed to any of these strands, it could prevent up to 90%. So imagine the amount of lives that are being saved. Imagine the amount of the distress of when people are being diagnosed with cancer, like what you're doing with this vaccine. So I know a lot of parents do worry about that it's so early. Why are we injecting this into our child? My child is not even sexually active. That's exactly the reason why. Because they're not sexually active yet is why you want to get them done. If they get it done way later, because as of right now, it's recommended for the ages between 9 to 26, but they have extended it now to the age of 45. So if you're up to the age of 45, you could get the vaccine, but what they've seen is that it may not be as effective or beneficial at that age, because chances are you would have probably already been exposed to it. A lot of HPV, as was pointed out, is the most common one right now. So chances are you may be exposed to it by the time you are 45. And so that's the problem. And that's why we want to vaccinate as early as possible.
Thanks, Dr. Kamara. Next question, is this vaccine required for school?
Yeah, so it is not required for school. It is not one of the mandated one of the mandated vaccines for school. It is one that is recommended. And that's how I always say it. Because sometimes parents will ask very specifically, when you start naming all the shots, they'll say, okay, which one does my child need? And as you pointed out earlier, if you wait until the age of 11, when they come in for their tetanus and meningitis vaccine, they're already getting 2. So now you're adding a third one. And so sometimes I'll get asked that question. Which one do I not need for school? And HPV is one of those that is not mandated for school, but I always tell them, I was like, although it's not mandated, I highly recommend it. And this is why. And that's when I go into the talk of the cancer prevention that we have. You know, I think a lot of people don't know this, that there's only 2 vaccines ever created as of now that prevents against cancer. That's HPV, and the other one is hepatitis B. And a lot of people don't recognize that. We have no other vaccines to prevent against cancer besides those 2 as of right now. There's treatments, but not that. So once that is explained, then that kind of settles their mind to say, okay, you know what, go ahead, just give it.
Great, thank you. Yeah, I think definitely driving home the cancer prevention point is a way around it being just so sex focused. My next question actually loops in with a question in the chat, so I'm just going to kind of lump them together. We've heard this a lot in the field, but does the vaccine cause any infertility issues? And are there any other potential side effects of getting the vaccine?
I'm really glad that actually that question was posed in the chat, because that is one of the main concerns that I get a lot, especially for parents who have daughters. Their concern is when they hear anything that's related to sex, right? Because once they hear HPV, they're thinking this is just a sex kind of vaccine. And does that mean that it's going to affect their womb or anything like that? Studies have shown the vaccine has been out for years now, and there have been studies that have studied it over longer than 12 years. It does not cause infertility. If anything, the concern that should come up is that if your child, your daughter, and later on in life does come back to have an abnormal pap smear and they have abnormal cancer cells, the procedures that they have to go through in order to either screen or the treatment, even taking the biopsy, that puts their womb actually more at risk of causing infertility, because you're doing more manipulation at that time to their cervix. And the cervix is actually the entrance right into the uterus, which is where the baby sits in. So by doing those other treatments, I should say, or other procedures, that's what puts them more at risk, but not the vaccine. And the main common side effects of the vaccine are the same ones that we see with any other one. You get pain in the injection site. Sometimes it could actually swell up around that area. You put an ice pack in it, take a little Motrin, go to bed, and you should be fine with that. But that is the more common one. One other side effect that I've actually just noticed on my own is that when this happens more in our young girls, after they get the vaccine, if they stand up immediately too fast and then want to leave, then they actually get a little bit woozy. So sometimes we just tell them, after you get that, just have a seat, wait at least a good 10 minutes or so, and then you're good to go.
Great, thank you. Yes, we've learned that fainting is actually more common in adolescents as well. So that's something that we also educate on and make sure that people are, remaining seated for 5 minutes before they run out of the clinic. But absolutely important to know that it doesn't cause infertility, and that it has, the common mild side effects as any other vaccine, and that after you get it, you should be fine and they'll go away on their own. So the next question that we have is, can a person spread HPV after getting the vaccine?
So great question. So the vaccine that's out now, the Gardasil 9, the reason why it's called the Gardasil 9 is because it protects against the 9 strands of the most common HPV strands that we see that are giving us the issues. As mentioned earlier, there's over 100 different types of HPV strands, right? And the one thing, just kind of help for those who are worried about, like, oh my gosh, there's so many of them, the vaccine only has 9, like, what is the point of all of this? Most of those strands, they're going to go away on their own. They do not actually cause disease to be progressed on forward. So sometimes you would have no symptoms of them at all. You have no clue that you even were infected with it, because there's no symptoms. And most of them will resolve within 1 to 2 years, that your body will actually just self-clear it out. But there are those troublesome ones that actually could infect other parts of our body, apart from the cervix, your mouth area, the anus, the penis as well. So those are the ones that we are concerned about, and that's where the vaccine focuses on. So just because you get the vaccine, can you pass it on? Simple answer is, can you pass on other HPV strands? Yes, you can. You could pass on other HPV strands, but we are worried more about the ones that causes issues. So that's what the vaccine protects against. And that's where the focus is.
I think that's a great distinction to make and really have that information out there, is that, while there are a bunch of different strains, only those that we worry about from a medical standpoint, we are being protected against. So my next question is, does HPV only affect girls and those assigned female at birth?
Great. Yeah. So that's a beautiful question because of the fact of we recommend that boys get it too. And again, we've so much focused a lot on HPV with cervical cancer. And so a person who has a son is like, well, my son doesn't have a cervix. So why should I even bother to even do that? But 70% of the head and neck cancers are caused by HPV. Also, 60% of penile cancers are caused by HPV. And as was pointed out earlier, the rates of the oral cancers are skyrocketing higher than even the cervical cancers. So this is why we recommend for boys to actually go ahead and get this vaccine as well. Now, here's the other thing too. The oral cancers, predominantly, there's other ways it could be transferred, but predominantly it's transferred through oral sex. And men are 3 times more likely to be infected with the oral HPV-related strands compared to women. So to put that in a more easier way to think about this too, if you were to have 10 people that were diagnosed with oral cancer due to HPV, at least 8 of those 10 people are men. So this is why it's really, really important that this is not a vaccine only for women, it's also for men as well. And now the other benefit of it is that if a young man gets vaccinated from it, you are preventing your future partners from either getting the oral cancers, as well as getting anal cancers, getting the cervical cancers as well. So it's future protection for your partners. And as was mentioned before, HPV, when it comes to cervical cancer, is the only one that can be screened by pap smears. We do not have a screening mechanism to check for an oral cancer. So you will not be able to know early enough in the early stages, do I have oral cancer? Because most of the time you have no symptoms of it. And by the time you do have symptoms of it, that means that it has actually already spread. So, and the symptoms that you do get are very subtle. So you may not even notice for a while what's going on, because the symptoms of oral cancer could be having a persistent sore throat that's not going away for a while. You're having a persistent earache. Sometimes you're having some swollen lymph nodes, which are those little circles or balls that you feel under your neck. Most of you should not be feeling that right now. So if you do feel it, you should not be feeling those right now, or even having difficulty with swallowing. So if you think about that, some people could just say, oh, I caught a cold. I have the flu. It could be COVID, right? I have a sore throat that's lasting for, I have a sore throat. You may not really think much about it, but it's those that are having the more persistent symptoms that say, okay, something's wrong. Let me go ahead and go get this checked. So again, this is another reason why, and I encourage healthcare providers to stress this, that is not only a vaccine just to help women, it's one that is also going to benefit men as well.
Thank you, Dr. Kamara. Super important that, and I still get those questions now when I'm speaking to parents, like, does my son need this? Or, yesterday I was speaking to a friend who I was talking about the HPV work that I do, and they were like, do I need to get that? And it's just like, yes, absolutely, you do, because it affects you as well. I am seeing questions in the chat, and I encourage them. Please continue to drop them in the chat, and they will be answered by Dr. Kamara after we get through these. So please continue to write your questions in the chat. The next one that we have is, do you have LGBTQ plus specific messaging to non-binary children or parents of non-binary children, and even non-binary parents?
Yeah, the main message with it is that HPV does not care what your sexual preference is. So whether you are non-binary, whether you are transgender, it does not matter. It's just, all it cares about is that it's being passed on skin to skin. And that's intimate skin to skin contact. So you can still pass it on to your partner, regardless of what their gender is, regardless of what their sexual preference is. So that's the most important thing. And I know it gets tricky to talk to your kids so early about sex. And bringing up this different issues or worried about, well, if my child has a different sexual preference, does it really matter for them? It does. It does, in the fact that it does not, there is no distinction when it comes to that part. So again, very, very important to just go ahead and vaccinate them as early or recommended for those healthcare professionals who are here, those who are parents who are listening on to just go ahead and just do that as part of their routine vaccination, because you are helping to protect your child from future cancer later on.
Great. Yeah, I focus a lot on LGBTQ plus education. And one thing I hear a lot is some people who identify as lesbian or women that just have sex with other women think they're not at risk for STDs or STIs because they're thinking, oh, we're not having the traditional, penetrative sex, so I'm not at risk. So I think getting that message across of just it can affect anyone, regardless of anything, if you're engaging in any type of sexual activity. I think that's really an important thing to drive home. So my next question is, do you have any special ways or specific ways that you recommend the HPV vaccine to your patients or parents of your patients?
Yeah. So usually the tactic that I've used now that I think works well is not to distinguish it from other routine childhood immunizations. So I just present it. So when they come in my clinic, usually we offer at the age of 11. But that's actually something, I've even learned something new. Watching this presentation itself is now making me think I need to rephrase that and just start pushing it even earlier. So that way they get in less of a shot when they come in for that 11-year-old visit. But the way I've done it, I'll just say your child is due for 3 vaccines today. And I name them. That is your tetanus vaccine, your meningitis vaccine, and your HPV vaccine. And so that way I'm not distinguishing it like, oh, this is the maybe kind of vaccine that you should get. Maybe this is a optional vaccine. I actually just put it all together. Usually I'll be asked though, like, explain to me why, like, what is HPV? Because people heard about tetanus. Most of the kids are already getting it since babies, right? The 2-month-old shots includes tetanus already. Meningitis, a lot of people have not heard of that word meningitis, but they're like, what is HPV and what is the acronym? So having to explain that. And what I have done personally too is even giving them my own personal experience as well, especially for parents who are hesitant. So this for me, and I'm sharing this for everyone here too, people may have their own stories, or feel free to even use this story as well. When I was in medical school, and I want to say this was I probably was about the age of 22 or 23. It may have been my first pap smear that I got, and it was abnormal. They just said we see abnormal cells. And I'm here freaking out because I'm so young. They're telling me that they see potential cancer cells. And I mean, my whole everything just went down. I've planned my life. I'm trajecting my life. I'm going to medical school. I'm studying hard. I'm stressing out, wondering why I did this to my life anyways. Why am I in this school to begin with? And then now to come and add that on top of everything else. And it was after they were able to take a biopsy was when they found out like, oh no, I'm actually okay. But just even going through that procedure itself was very, to me, traumatizing. And right after that, I ran and got my HPV because I did not have my HPV vaccine. So actually I ran and got my HPV vaccine after that. And since then, I've not had any abnormal pap smears. So I share that particularly to a lot of mothers as well, just to let them know, like, this is real. This is not just something that, could just by happenstance just happen. And, in particular, I'm very biased, I guess, towards Essex County since I work here. So when I was looking up the rates and like how you showed like our vaccination rates when it comes to HPV is pretty low. And Essex County is actually one of the top 6 counties in all of the state of New Jersey that has the highest rate of HPV infection. So we need to do better as providers. We need to do a better job in just explaining, because sometimes it's just lack of knowledge that people don't know and is explaining. And a lot of times too in Essex County, most of the populations that live here, we have a lot of Black Hispanic population, and HPV cancers, including the deaths, are predominantly, unfortunately, more on Black Hispanic women, including American Indians and those of Alaskan background as well. So I emphasize that too, to say that it is mostly affecting our this community, including the death as well. Like even if they were to find it, the chances of it leading to death is higher in Black and Hispanic women as well. So those are the facts that I actually bring up to them to mention, like, okay, this is why I feel it's important and why I recommend it.
Thank you so much for sharing your personal anecdote with everyone here. I think it's really important to share our stories. And look, it comes from a doctor, someone who is, highly trained and educated. So if it can happen to you, it can really happen to anyone. And it's really important for us Black and brown women as well to share this information with others and let them know, like, hey, this is especially relevant to you and your health and your future and your children, because we have the highest rates. And so definitely important to, recommend it as early as possible, and making sure that, our young children, before it becomes a sexual education kind of topic, that we remind them, hey, it happened to me, it can happen to you. And this is cancer prevention. So thank you
Absolutely.
again for sharing. This kind of leads into the next question of, how do you address misinformation regarding the HPV vaccine that we know is out there? We know that there's a lot of crazy stories, or a lot of things about the symptoms or about side effects, especially with the infertility. How do you address this misinformation?
Yeah. And as you said, especially now with the day and age of technology, we have access to information at our fingertips. Everyone uses Dr. Google, right? So you just type in whatever symptoms you're having, you type in whatever vaccine you have a question or doubt about. And the one thing I've actually told families, because I not only get it for HPV, I mean, let's talk COVID, right? In COVID, there was so much stuff that was going around with it. Flu, I remember when we were first giving it out because of H1N1, I mean, I heard things of my child's going to walk backwards. We're going to be turned to zombies and everything like that, right? So you hear so much. And I tell parents this, I'm like, whatever answer you're looking for, you're going to find it. So if you've made up your mind that this vaccine is bad and you Google it, you're going to find whatever vaccine you choose is bad. If you want to look up this vaccine is good, you're going to find it by just simply Googling. So I always tell them, the first thing I ask is, what did you hear? So that way we could start with the basics. And then I tell them what I know. This is what I know of the vaccine. And I also let them know, like, I don't recommend a certain vaccine just because of the fact I'm a doctor. Most people think that when we go to medical school that we actually are taught, tell your patients this, tell them to get vaccines. And actually, believe it or not, to everyone who's listening, medical school, when I was in medical school, so maybe it's changed, but when I was in medical school, there was no class actually on, you need to tell a person to take this vaccine. Instead, what we saw was the consequences of the diseases. When you see that, I mean, there's no erasing that. When you actually are the one seeing what cervical cancer looks like, when you've been there for those procedures and seeing what the biopsy looks like, you don't have to be convinced to say, oh, maybe I should maybe recommend this vaccine. You're going to want to do that because of the disease pathologies that you actually do see from it. So I always just ask people, first, tell me what it is that you are, what it is that you've heard. I'll tell them what it is that I know. And then I tell them, be careful of who you're finding your answers from. Research the people. You want to make sure that these people are actually legit, because anyone out there could just walk around and say, I have an MD. If they put out a study, do you know how to read a study accurately? Do you know what it means to say, like, oh yeah, this study was accurately done? So, that's kind of like how I kind of tackle around with that question.
Great, such great information always. So this also, I mean, my next question also sort of ties into everything we were just speaking about, but do you have any specific moments that you remember where you were able to convince someone who was very anti-vaccine to potentially then vaccinate their child, like any kind of little success stories and maybe how you went about that?
I do have one. Unfortunately, I could not get them to do the HPV. That was the one I was not able to convince them on. But it was actually, so this was a family who never vaccinated their children at all. And so they came in because I believe the child was either going to high school and almost ending high school, going to college. And they were like, okay, what vaccines are required? If you were to pick, and they asked me, if you were to pick the top 2 vaccines, what would you give? And I began to, of course, list at that, because that age group, Tdap, meningitis, HPV was there. And once I said HPV, they were like, no, I don't want to do that. But when I went on to tetanus and meningitis, they were like, tell me more about that. And again, I used my own story of what does meningitis looks like. I've seen meningitis and I've seen it kill in 24 hours. So, and it looks like a cold. So you would just miss it. So once I mentioned what it is that could potentially happen, and also to tell them how much is actually out there. right? Because people think, because now, especially now for those who, we have a big non-vaccinated movement that's going on now. And I think a big reason is because we don't see so much of those disease ideologies anymore, right? We're not walking around seeing polio and seeing people being paralyzed from polio. We don't walk around now. Chickenpox almost does not even exist anymore because of the vaccine that came out. So you're not even seeing chickenpox. And even back then it was like, well, who cares? We all had chickenpox parties and everybody got chickenpox. Yeah, but you've probably never had shingles before. And that's what chickenpox prevents against. So those are the things, and I caught shingles, of course, me. Why wouldn't I catch shingles, right, at this age? But so those are the stories that I tell them, where I will let them know, well, this is a disease pathology. And this is why it's important, and that to remind them that it still exists. So although you don't see tetanus, although you don't see polio, although you may not have seen meningitis, it's actually still out there. And with HPV, I think now more so than ever, especially with the high rates that we are seeing that's happening, especially with the oral cancers. And that has kind of been hidden on the low key, that people don't really talk about that. But now that we're seeing those, if you're able to highlight that more, I think that will convince even those who may not want to just say, you know what, I'll consider. Or the one time, the kind of close success that I had was the mom told me, I'm going to have my daughter personally speak to you when she's older. Meaning, and she was shooting for like the age of between 16 to 18. I'm going to have her speak to you. And if she makes that decision, then she could get it. So, and that was just from just explaining, you know, what this vaccine would do. So I will say that's the main thing to do. One of the main things.
Thank you. That's great. Yeah. And I think what's so tricky about public health is that when people aren't seeing things anymore, when people aren't seeing diseases anymore, that's when we know that we're doing our jobs, right? In public health, we're being effective. But then on the other hand, that's when people start to kind of, I guess, forget that this is something that still exists and that it's still out there. And that's when public health is challenged the most. So then it makes our work even harder sometimes, but it's continuing to do so is, you know, what's important, and continue to bring these messages across to parents is where we make the difference. So this is our last question from our round of questions, and there are some in the chat, so I will definitely ask those after this last one. But we know that you are with, you know, the East Orange Health Department and also at Foundation Pediatrics. So we want to ask you, do you provide free or low cost vaccines?
Yes, definitely. So here at the East Orange Health Department, for those who are uninsured or have Medicaid Part A, you could get your vaccine here for free. So if you're not, if you do not live in the city of East Orange, wherever you live at, most local health departments offer these vaccines, regardless of whether or not you have the ability to pay. So it is free. It is a program that's done by the states that offers us to give free vaccines. At the other group practice that I work at, Foundation Pediatrics, we offer it for a very low cost as well. So there's always that option. Usually what I even do is when I do see a patient there that does not have insurance, I would actually tell them like, hey, right down 5 minutes down the street, I could do your physical here today, and then just go down the street and get your vaccine. So now that it's back to school, a lot of kids are coming in to get their physicals done and everything. So even if you work at another county or another city, the local health departments, you could call just to make sure before you refer your patients there, but just ask. And most of them do offer it for free. So that way you could do your physical and then send them over there. Why pay the extra money if you don't have it?
Right. Absolutely. Thank you. Ashley, I don't know if you would like to share the following question in the chat room. Or I can.
Yeah, I can get started. We did address the one already about potential side effects. So the next question that came through is actually a great question because I had this question myself. If you started getting the HPV vaccine, but you don't remember if you finished the series, do you start over or do you sort of pick up from where you left off?
Great, fantastic. That's actually a really, really good question. Yeah. If you remember at least getting one shot, which most people do because HPV is not given as a baby, right? You're given it as when you're a preteen or a teenager. They'll remember I got one shot. You do not have to restart back the series again. You just continue on from there. If you do not remember at all, because let's say it was done at the age of 11 where they were given Tdap and meningitis and maybe the flu, so you don't know which one, it is actually okay to restart the series again. It does not cause any extra harm if you were to be vaccinated duplicate with that. But the most important one that Yoreni pointed out earlier was that if you do it before the age of 15, it's only 2 shots, separated by 6 months apart. So it's only if you get it after the age of 15 where they have to do a 3 series. But in either way, you do not have to restart back again.
Okay, great. Yeah, so it sounds like it's up to you. You know, if you remember getting one, at least follow up with the second one, or if you know you're just like, I don't remember what I what I did as a teenager, that it's okay to just kind of start right from the beginning. So that's great to know. So I'm scrolling. The next question I see here is, what, if any, is the relationship between HPV and hepatitis B or C, if there is one?
I've not come across that. So I've not seen a linkage between HPV and hepatitis B and C, because the HPV strands causes specific HPV related cancers as compared to Hep B, which is one of the vaccines that we have that protects against Hep B cancer. So from what I've seen, they are 2 separate entities. I've not seen really, from doing my research, any linkages between the 2, but that's a good question.
And there was sort of a second part to that, since you did mention that there's those 2 vaccines as preventative tools. Do you offer any free or low cost resources available to people affected by these? I'm assuming maybe the Hep B vaccine, since we did just talk about HPV.
Okay, I guess I can answer it in one of 2 ways. If they're saying that whoever that person is, if you could clarify that question if you're able to, but I'll answer this way. In terms, I'm assuming you're saying that if the person is positive for hepatitis B, do we offer any low-cost services? So where I work at, because I do outpatient care, so ours is more preventative care. That's my thing, that's my zone, that's my domain. So we're not in a hospital setting, but there are programs actually that are out there about Hep B. The one thing for sure, especially for babies wise, is that when a child is born to a mom who we do not know their status, their hepatitis B status, or if they are positive, like they actually they are able to undergo treatment with that. So there are treatment programs that are out there. I just don't have those resources available at hand, and we do not do it here at this local health department. But I'm sure there are others that you could look into.
Great, thank you. Sorry, just now scroll on full Google. That's funny. So the final question I see in the chat is, you know, we know women, they go to the OBGYN for those types of services, but their question is, how would men go about getting tested for HPV, and really what type of doctor would they see for that?
Yeah. So unfortunately, because of the fact that a man does not have a cervix, and that's the only way that we're able to actually check for HPV is through a pap smear, there is no way to check. The only thing that could be done is treatment-wise if the person does develop anything else. So for example, if they were to develop genital warts, those can be removed. There's even creams for it, and it does go away. If they were to develop, God forbid, like any of the cancers, whether it's penile cancer, anal cancer, oral pharyngeal cancers, that's when now they have to go through the treatment procedures. But I'm glad that that question was even asked. Oh, great. It looks like somebody posted up something about the perinatal hepatitis B resource. Thank you. Thank you for that. Thank you, Emily Haynes. But if the most important thing then that just goes with that is actually then now saying that's the push, right? Because of the fact that a man cannot get tested, you will not know until they actually develop symptoms. This is why we need to go ahead and actually do the vaccine, because it works so well. I mean, to me, when I actually thought about it and put it all in numbers, 97% effective if you were to get vaccinated before you even dreamt about touching a man or a woman, right? Before any of that thing. To me, that's a high GPA. What is that, a 3.9 GPA, right? But in all honesty, just putting jokes aside, that is so effective. And this is cancer we're talking about. We're not talking about a bacterial infection where you have a strep throat and I give you amoxicillin for 10 days and you're okay. We're talking about cancer that you may need chemotherapy, radiation, and all that comes with it as well. So this is why for men too, to stress that importance that there is no pre-screening to be done. It's more prevention.
Thank you so much, Dr. Kamara, for answering our questions. If anyone has any additional final questions, this is the moment to either unmute yourself or, drop it in the chat. I will be sharing my screen one last time with everyone, just so that we can give our final remarks before, this presentation ends. So, on behalf of the partnership, I do want to share that August is National Immunization Awareness Month. And as at the partnership, we have numerous events that are going on this month that have started since August 1st all the way to the end of the month. You can see on the left-hand side, we have an immunization education series where you can, just log in Facebook and Instagram and see our weekly episodes that we're sharing with everyone. Also, we have Andre's Armor Parent Workshops, which is a reading of the children's book Andre's Armor, to follow along with Andre as he visits his doctor to learn how vaccines work. So this is for parents to join and remotely. And so if there are any questions or anyone is interested in joining, if you are a parent or if you know a parent of a child, please reach out to me at the end of this presentation so that I can share how to, join. And you can also actually join on the QR code on the screen. Also, we do have immunization presentations. Today was, our talk with Dr. Masiray Kamara, but we do have a pediatric immunizations with Bloomfield Health Department happening on Friday, August 18th at 12 p.m. on Zoom, as well as, an HPV presentation that's meant for the community with the American Cancer Society happening on Wednesday, August 23rd at 5 p.m. also on Zoom. So I will be posting a flyer for this in the chat for anyone that's interested in attending any of these events. But then, shameless plug, I personally do presentations on human papillomavirus for healthcare professionals. And so this is a guide to speaking to families about HPV. And we do provide a continuing nursing education contact hour credit. And so if you do register on behalf of your clinic or your site, we can coordinate to schedule a presentation with you. This is just a flyer for one of the previous presentations that we done recently. And I will share my contact information on the next slide so that you can, reach out to any one of us. And, if you want to register for any event, if you want to register for the healthcare professionals workshops that is on the right-hand side here, you can do so. And again, if there are any additional questions, please let us know. As you can see, this is our information here on the screen. Dr. Kamara is on the left-hand side, mine in the middle, and Ashley is on the right. If you are interested in any of these events, or if you have any follow-up questions, please let us know. And we thank you all for joining us today for this presentation. And also, thank you so much, Dr. Kamara. You were excellent. Thank you for all of your knowledge and sharing that with all of us here.
Thank you. Thank you for having me.
Yes, thank you. If there is time, we did have one more question that came through.
Awesome.
So if someone were to receive a positive diagnosis for HPV, what does the treatment and or referral process look like? And where would these patients be treated?
Yep. Okay, so when it comes, so actually this probably I should have mentioned this a little bit earlier for the screening that happens, right, for HPV. So with the pap smears, now it starts at the age of 21, regardless of whether you've had sex before that age. And then it's done every 3 years. And then HPV is checked now. Once after the age of 30, they will just go ahead and add that. But if a pap smear does come back up normal, they will check to see was it due to HPV and which one. So if it does come back positive, after that now it depends on what it is that they do see, because there's different stages of how abnormal the cells could look. So whether or not first it's just that initial scrape that they do and they say, okay, we're going to follow this, versus that we need to take a biopsy for them to be able to look further into it to see what other procedures are there that needs to be done, if any, versus is it going to clear on its own. But that's the initial step. If that helps to answer this question, that's the initial step that can be done. Where do you go? This is your gynecologist. This is why it's important for us to have our gynecological appointments and stick to it. And now a lot of women only go if they're pregnant, And then after they have the baby, that's it, they stop. But this is one of the more important reasons why that you should see your gynecologist and make those appointments. And then from there, depending on the stage of where they do see the cancer, if it is cancer, then they're able to tell you what comes next after that.
Wonderful. Thank you, Ashley, for catching that question because I almost missed it. Thank you so much, Dr. Kamara, for answering all of our questions. And we hope that everyone has a great rest of the day. And, you know, make sure that your patients, you're advocating for these vaccines and that you're having these conversations with them for back to school. I'll be on just to if anyone has any additional questions or comments or concerns. Thanks, everyone.
Thank you, everyone.
All right, I'm going to go ahead and end the call. Thank you so much again, both of you, Ashley and Dr. Kamara.
Yeah, thank you for having me.
Absolutely. We'll talk offline. Bye.